I'm George Leventhal. For the last 16 years, I've served as chairman of the Health and Human Services Committee of the Montgomery County Council. And we've done a great deal of work to keep Montgomery County in the forefront of public health, such as the Montgomery Cares program, which provides 34 community clinics run by 14 different institutions that each year makes available 70,000 patient visits for individuals without health insurance. We support the Maternity Partnership Program, which provides prenatal care to expectant moms who are disadvantaged and don't have access to health care. We support the Care for Kids program, which makes sure that everyone under the age of 18 who doesn't have other access to health insurance has access to a doctor. We believe so strongly in equal outcomes, elimination of disparity, and access to care. We seek the triple aim for healthcare. We want to improve population health, we want to improve the patient experience of care, and we want to bring down the cost of care. How did I get so interested in public health? Well, the great inspiration in my life was my mother, Dr. Bridget Gray Leventhal. She was a distinguished clinical researcher. She was a pediatric oncologist, and she pioneered many treatments and therapies for children's cancer. She was the first director of the Pediatric Oncology Center at Johns Hopkins Hospital in Baltimore. We lost her in 1994. She passed away, sadly, from cancer. And my first son was born just a year after my mother passed away. My first son was born in 1995. And my second son, Chico, was born in 1998. And when Chico was just a year old, he was diagnosed with Wilms tumor, which is a cancer of the kidney. It's a childhood cancer. And it's, it could have been life-ending, but we got excellent treatment at the Pediatric Oncology Center, which my mother had founded. And my wife and I would often, try to console each other during those difficult times, and we would say, if only Bridget were here to give us advice, wouldn't it be great if we could call on her? And people would try to comfort us, and they would say, well, she is here, she knows. But the thing is that our son was treated at the Pediatric Oncology Center that my mother founded. He was cared for by the doctors and nurses and physician's assistants who my mother had recruited and trained, and he was cured by the treatments and therapies that my mother had pioneered. So the work that my mother had done, her legacy, saved the life of the grandson she never met. And so if you want to understand why I'm so committed to access to health care for everyone, no matter how wealthy, if you want to understand why I believe so firmly in Montgomery County's future as a biosciences and life sciences hub, those industries that are consistent with our values, the industries that focus on curing disease and alleviating suffering, I'm committed to those goals because I want to honor my mother's legacy. And I hope that the work that I've done to provide access to care will have an effect on people in the future who will never know my name, people who I've never had the chance to meet. The work that we do in public office goes on after us. It's all about helping people. And if you make me your next county executive, I know I can help so many more people.